Welcome. So my name is Tamatha Webster, and I'm here today representing the Insight and Voice team from NHS England. And we're here to talk to you about the results from the 2024 Under 16 Cancer Patient Experience Survey. So thank you very much for sharing your time with us today. We're going to share both the qualitative and quantitative results, and we'll walk you through the agenda in a moment. Just before we dig into the agenda, just to note that this survey is really quite unusual and quite special, given that, of course, it gives us an opportunity to hear from children and young people about their care experiences directly. So one that's very close to all of our hearts. So if we can move on to the next slide, please, and I'll just give you a little bit of an overview of the agenda for today. Okay. So we've broken the morning up into various different slots that you can see on this slide. So first of all, we're going to focus on the quantitative results, and then we'll move on to the qualitative results. There'll be an opportunity for Q&A at the end of each of those sessions as well. So, we then want to put you to work. We've got some questions for you, and if you're able to share some of your thoughts and reflections on the results when we break at 10:35. So make notes as you're going through. We will be testing you on that. We're then going to move over to our colleagues working on the cancer programme in order to hear their perspective, and then there'll be an opportunity for any broader feedback that you want to share with us before we close. So if I move on to the very exciting housekeeping section. So as you probably expect from webinars of this size now, we're going to keep microphones disabled while the presentations are ongoing. Please feel free to use the chat function. Some of the questions my colleagues will be able to respond to as the presentations are ongoing, but there may be some that we have to pick up in the Q&A section afterwards, and depending on the number of questions, we may run out of time and we may need to pick some up offline and come back to you, but we'll do our very best to get through as many as we can. When we get to the Q&A session, please feel free to raise your hands and ask questions to us directly as well. Don't be nervous, we're all very friendly here, so that's an option if you prefer to speak to us as well. So without further ado, I think we are now going to move on to the first presentation, which is our very own Zoe Oliver, senior analyst in the quantitative team, who's going to talk us through the quantitative results from this year's survey.
Perfect. Thank you so much, Tamatha. And good morning, everyone. I'm Zoe. I'm the senior quant analyst on under 16s at NHS England. And yeah, I'm going to be taking us through the national quantitative results today. Some of the areas that we're going to look at include overall experience of both parents and young people. We'll be looking at some subgroup differences, as well as highest and lowest scoring questions and trends over time. Before we get into the actual results, just a quick note on what outputs are available. So we've published multiple outputs, 2 national reports, one quantitative, one qualitative. We have Excel data tables, as well as PTC level reports. So we have individual quant PDF reports and also the free text workbooks. And then we also have our interactive dashboard as well, where you can find all sorts of levels of data. So you can find all of these outputs on the website. I've just included here a screenshot of what that looks like on the left, and then just a screenshot of the dashboard on the right. The dashboard particularly, I think, is really user-friendly. You can interrogate the data by trends and subgroups. So if you are going through this presentation and there's something that you would maybe like to look at for your own PTC, please feel free to do that. I think it's quite good to get a quick overview of what breakdown you're interested in before then going into the deeper detail in the individual reports. So we do collect a range of demographic and clinical information. The breakdowns that you see on the screen here are available for all scores and across years as well. So we have demographics like age, ethnicity, sex registered at birth, and then some clinical subgroups, so around long-term conditions, diagnostic group, and the stage of treatment that the child is in. Just to note, so the sample includes all patients under the age of 16 with a diagnosis of cancer or tumour in 2024. So it's essentially a census of all the patients, but this is just within PTCs, so it doesn't include those patients that are exclusively under the care of POSCUs. Otherwise, it is a census. As for response rates, so in 2024, we had 759 responses from over 3,400 eligible patients, and this gave us a response rate of 22%, and this compares to 25% the year before. So most of the responses were via paper, around 67%, and then 33% online, and this is broadly in line with previous years. We do occasionally have one or two from phone or the translation service, or mixed paper and online, but none this year. We also had 459 respondents leaving open-ended free text comments, so Estelle will be taking us through those in the qualitative section. And now just a last note before we get into the actual results. So for the quant results, whenever any scores in this presentation are being described as being notable differences or improvements, this is where confidence intervals do not overlap. So just a reminder of what confidence intervals are. They're the range from within where we think the true value lies. So if they overlap, like in the example that you see on the screen, all 4 years here overlap, it means that we can't be sure that there is a true difference. It could just be due to random variation. But if they don't overlap, we can be more sure and we can comment on this. So this is the same method that we use in all of our reporting for the quantitative results. So if you do want any more information on this, there's a breakdown in our technical document on the website, or feel free to ask any questions. So on to the results. First up, we have the overall experience scores. So parents and children both are separately about their overall experience of care. Both parent and child overall experience scores showed no notable differences across years or between age groups. They're consistently quite positive scores, but just to say, in the next few slides, we will just be talking about 2024 data only. So looking at the children and young people score, 78% of children aged 8 to 15 reported that they were very well looked after for their cancer or tumour by healthcare staff. And similar scores across age groups. You can see there the confidence intervals, they do overlap. So for all of these charts, we'll have the overall score in navy on the right there. 12 to 15 age group is in blue, and then we have the 8 to 11s in pink here. And then we have the 0 to 7 here for the parents as well in grey. So for the parents' overall score, 91% of parents and carers rated the overall experience of their child's care as 8 or more out of 10. And again, similar scores across the survey types. They're quite consistently high. And now looking at the mean score for parents. So parents and carers gave a mean rating of 9.1 out of 10 for the overall experience of their child's care. And across the survey types, no differences, again, quite consistently high scores there. Now we're going to look at the parents' overall experience score broken down by subgroups. So across all of the subgroups, the scores ranged from 8.13 out of 10 to 9.58 out of 10. Again, quite high, and most groups do show no notable differences from the national average, but some groups do differ. So some groups from the diagnostic group breakdown, the impact of cancer or long-term condition, and the child's current care or treatment stage. So some of those that were higher than the national average was the parent score for children that had retinoblastoma, children that had that their long-term condition or cancer did not impact their day-to-day activities at all, and the children that were in remission or long-term follow-up. And then there was one subgroup that scored lower than the national average, and this is children who cancer or long-term condition impacted their day-to-day activities a lot, and they scored 8.7 out of 10. Next, we're going to look at questions that are typically the highest and lowest scoring within the year. So first up, we're going to look at the highest scoring questions, and these are questions that scored over 90% in 2024. So all of these questions that we have on the slide here, they are consistently above or around 90% across years, and again, no notable increases or decreases across the years for these questions. So in 2024, there were 5 questions that scored over 90%. We saw that 97% of parents, carers and children reported that staff provided details about who to contact for more information after being told about their child's diagnosis. 94% of parents, carers and children felt that the nurses that came to their school or their home were always friendly. And 91% of parents felt that they and their child were always treated with respect and dignity by staff. 90% of parents and carers reported that there was a main person in the team that they could contact about their child's care or treatment. And then we have that same overall experience question that we just saw. So 91% of parents rated their overall experience as 8 or more out of 10. Then looking at the lowest scoring questions in 24, we had 6 questions that scored below 50%, majority being stable across the years with the exception of the Wi-Fi adequacy question, which has seen an improvement since 21, but we'll get to that in the next section where we'll look at changes over time. So some of the areas that typically do score lower, so one area is food satisfaction, 40% in 24, 40% of parents, carers and children felt that there was definitely a suitable choice of food in the hospital, and 42% of parents were definitely able to prepare food in the hospital if they'd wanted to. Another area is overnight facilities, so 35% reported that the facilities for them to stay overnight were very good. And 26% of parents, carers and children reported that it was always quiet enough for them to sleep whilst they were in hospital. In terms of nurse continuity, 43% of parents, carers and children reported that the same nurses had always come to their home or their school. And in terms of Wi-Fi adequacy, 42% of parents and carers said that the hospital Wi-Fi always met the needs of them and their child. So next, looking at changes over time, we're going to look over the 1-year period first, so 23 to 24. Over this 1-year period, we see no notable decreases, and the majority of the scores do remain relatively stable. But we did see 2 improvements over the 1-year period. So the first improvement was around support for side effects. We saw that 80% of parents and carers reported that staff definitely offered them support to help manage their child's treatment side effects. And this is an increase from 71% in 23. And we also saw an improvement from the previous year in the question that asked about how easy it was to get in contact with them, get in touch with their main contact. And this was 56% of parents and carers said that it was very easy to contact this person. And that's an increase from 47% the previous year. We don't have any data for 21 as this question was introduced in 22. Now looking over the 4-year period, so again, we didn't see any notable decreases and the majority of scores are remaining relatively stable, but we did see 3 improvements over this year, over the 4-year period. So first up, we have the same side effects question. So we saw improvements over the 1 year and the 4-year period, relatively stable looking from 21 to 23, and then seemingly we have an increase in this latest year. And we also saw an improvement for the question that asks about things to do whilst in hospital. 52% of parents, carers and children felt that there was definitely enough things for them or for their child to do whilst they were in hospital. And that's an increase from 43% back in 21. And lastly, we saw an improvement in the Wi-Fi question, as I mentioned. So 42% of parents and carers felt that the Wi-Fi in the hospital always met the needs of them and their child. And that's an increase from 34%. So still quite low, but there is a detectable increase over the 4-year period. Also on the Wi-Fi adequacy question, so we saw that 2 specific PTCs had notable increases over the 4 years. So first, the Royal Marsden and St George's PTC saw an increase of 30 percentage points, going from 21% to 51% over the 4 years. And we received some information as to why this might be. So a colleague had the following to say. There was a Teenage Cancer Trust funded booster at the centre in Sutton in 2022, and around a similar time, the whole site internet access also improved. They say that staff say that it's easy to get on and off the internet now, but if a child wants to play online games, there is some bandwidth issues still. So encouraging to see that changes are being made and reflected in the survey scores, but still they identify that there is opportunity for improvement here. And also over the 4-year period, Cambridge PTC showed notable increases, seemingly a sharp increase in 2022 rather than a gradual like we saw with the previous scores. And a colleague had the following to say, there have been improvements made trust-wide to the Wi-Fi availability across the whole of CUH. And now just a final few slides on the key questions that we've not yet covered. So all of the questions in these last few slides have remained stable over time, or no notable increases or decreases. The data shown here will just be 2024. So 75% of parents, carers and children reported that the information at diagnosis was definitely given to them in a way that they could understand. And again, quite similar across age groups there. 70% of parents or carers reported that they were definitely told about their child's cancer or tumour diagnosis in a sensitive way. And we do see some differences for the 8 to 11 cohort there. You'll see that those confidence intervals are not overlapping. 83% felt that they always had confidence and trust in the staff that were caring for their child. 79% felt that the staff definitely offered them enough time to make decisions about their child's treatment. 60% felt that the hospital staff were definitely aware of their child's medical history. And this question refers to different hospital staff within the same PTC rather than across PTCs. 63% of parents and carers reported that they definitely had access to reliable help and support 7 days a week from the hospital. And lastly, 63% again of parents and carers felt that they definitely received enough ongoing support from the hospital after their child's treatment had ended. And again, quite similar across the age groups. That is an overview of the national quantitative results. Thank you for listening, but I'll pause here if there are any questions on the data before we move on to the qual findings, which Estelle will take us through.
Okay, thank you, Zoe. Unless I'm missing any hands, I don't think we have any questions on the data right now. Just before we move on to Estelle talking us through the qualitative results, I realised that there's a glaring omission in my introduction. So if I can just reflect on some of the questions, please, that have been posted in the chat bar, because these will form part of the test after the next presentation. So what we'd like you to think about as you're reflecting on both what Zoe has talked us through and also what we're about to hear from Estelle, we really want you to think about what's perhaps surprising you the most about the results that we're reporting this year, or which insight is resonating most with you. If you're in the NHS, are there areas there that you think you'll be prioritising to make improvements, or have examples of improvements that have been made that you would like to share with the group? And if we have any parents or carers on the call, what actions would you like to see based on findings from the report? So these are the three overarching questions that we'll loop back to at the end of the focus on the qualitative results. So without further ado, let's hand over to Estelle to talk to us about the results of what people told us in their own words when responding to the survey.
Thanks. So yeah, just to introduce myself, I'm Estelle, the Qualitative Senior Analyst in the Insight and Voice team. And as has been said, I'm going to talk through the qualitative results. So just to give you a little bit of background before I launch into it. So in the survey, respondents, with the exception of children aged 0 to 7, were given the opportunity to state anything else that they'd like to tell us about their care or their child's care in their own words. So in the survey, there was one question asking what was good, and there's another asking what could have been better. And what we did, we took a sample of 654 comments and we thematically analysed those, and that included all of the written feedback from children and young people, which was 327 comments, and then we took the same amount of comments spread across parents or carers across different children age ranges, questions and PTCs. When I go through the findings, you'll see that I've added respondent quotes throughout, and that's to evidence the findings and bring them to life. But just to point out that we haven't edited those comments in any way, so any spelling or punctuation, it's basically as was written by the respondents. We've made no changes to that. It is a whistle-stop tour of the findings, so I would encourage you to have a look at the full report afterwards. You'll find a lot more detail, a lot more quotes, and also information on the methodology that was used for the analysis, if that's of interest to you. So I'm going to launch into the actual findings now. So this is basically an overarching slide of the themes that came out of the analysis. So There were 7 high-level themes, and you can see those in the dark blue boxes at the top, and there was 30 underlying sub-themes. So on this slide, you can see the names of all of those, but I'm going to talk through each of them as we go through the slide. Also worth mentioning that what we saw this year really closely mirrored what we saw in 2023, and there were just 5 sub-themes that didn't appear last year. And again, I'm going to draw attention to some of those as we go through. Where there were some changes seen from last year's findings, we should also mention that that could reflect real world changes, but it could also be that these were things that were previously experienced, but respondents chose not to comment on them in the past. So it could be that there's been a subtle shift in emphasis. Okay, so yeah, I'm going to launch into the more detailed findings. I'm going to go through each key theme in turn. So the first one that we had was all about staff. And then the headline around that was gratitude was expressed with a particular focus on the role staff played in care experiences. Positive attributes such as kindness and friendliness were highly praised, and areas for improvement focused on training, continuity, and ensuring staff were listening, understanding, and involving patients, parents, and carers. So reflecting what we also saw in the quantitative data, where 2 of the highest scoring questions related to overall experiences and nurses being friendly. In the qualitative, so positivity about staff was the most prevalent theme that came out. And here, respondents talked about the key attributes that they really valued in staff. So they praised staff when they were kind, friendly, helpful, caring, supportive, professional, dedicated, and compassionate. And what they told us is when staff acted in that way, that made children feel safe, comfortable, special, and it also built trust. And it also generally made a difficult time more bearable for children, parents, or carers. There were a few exceptions to this. So some examples provided where staff were rude, they needed to be friendlier, more empathetic. But if we take this sub-theme as a whole, it did really demonstrate how all staff interactions play a critical role in how care is experienced. We then had a sub-theme around staff training, which was a new one this year. So there were calls for improved staff training in A&E, local hospitals, or non-cancer wards in hospital to meet cancer patient needs. So if we think back to the quantitative data, that showed that 83% of parents or carers felt they always had confidence and trust in staff caring for their child. When we looked at the qualitative data, there's some suggestions there that this might vary by setting, or there was some nuance. So you can see the focus really is on staff in A&E or local hospitals. And when you read the comments, that was often framed in contrast to staff on more dedicated oncology wards who were considered more specialised. So continuing with the staff theme, staff listening, understanding, and involving was seen as important. And could see that engaging on a personal level could make people feel welcome, supported, and safe. Being listened to allowed involvement in joint decision making, but where you saw improvements were needed, that was where concerns and feelings went unheard, or they were even invalidated by staff. And that you see there that there was a link to delayed diagnosis where people weren't being listened to. Then in terms of staff continuity, we did see a preference for children to be cared for by the same staff, and it was inferred that staff continuity would have benefits in terms of building relationships and improved communication. And we see this little strand about staff continuity weaved through some of the other findings as well. Okay, so we're on to the next theme, which is a really big, substantial theme around communication. So the headline here was features of good communication between staff and patients, parents, carers were highlighted, as well as some opportunities for improvement. Issues were experienced with communication between hospitals, within hospitals, as well as with parents or carers outside of hospital stays, and the need to be kept informed was evidenced as important. So on the positive side, where communication with staff was viewed positively, could draw out quite a few different aspects where value was placed. And you can see those in the lighter blue boxes near the top of the slide. So where things were positive, that was people getting timely, clear information, staff being open to discussion and being asked questions, procedures being explained prior to them taking place. So appropriate level of detail in the information, staff were addressing children, not just parents or carers. Information was tailored to make it understandable, and sufficient time was taken to provide explanations. So that's the positive side. Where people were less satisfied, the things that came through there were consideration of privacy, consistency, timeliness, and information at the start of hospital stays. So a few examples of that, and do have a look at quotes at the bottom as well, because they really illustrate these well, is having consideration who was present when diagnosis information was shared. So whether the child should be there, how many members of staff, whether other service users could overhear the communication. We then had improving staff continuity and availability to facilitate information being consistent and timely, and that included at weekends. Again, this idea of things being a bit different at weekends is something that we see across quite a few of the findings. And also providing practical information about life on the ward. Continuing with communication. So poor communication within hospitals was observed, and that included staff not always having the same degree of information about patients, and that could lead to confusion, delays, and parents, carers having to intervene. Again, issues of staff continuity were seen to be a contributing factor there. So that was within hospitals. Also, poor communication and record sharing between hospitals was seen. Again, that could lead to parents, carers having to relay information, and also delays to treatment. And then the next sort of strand we had there was the ability to communicate with services outside of hospital stays was variable. So flexibility as to when people could contact services was important, as well as using different methods which best aligned to with people's needs. So whether that was phone call or through the app, etc. And then finally, on communication, more generally, parents, carers were not always proactively kept informed, and that could be about test results, cancer levels, treatment decisions, or just more generally what would happen next. And where that was the case, that left them without reassurance. Okay, so we're on to the next theme, which is all around access to care. So here the headline was how long it took to get a diagnosis and treatment was variable, and delays were attributed to multiple issues. Staff were not always responsive to needs, and there was links made there to understaffing, particularly at weekends and nights. And long waits in the hospital were a frustration, with travel issues also impacting access. So whilst diagnosis and receiving treatment happened very quickly for some, others shared harmful impacts when diagnosis took longer than they thought was necessary. And where there were delays, they pointed to a few different interrelated issues. So that seemed to stem from not being listened to, including by GPs and at A&E, a lack of urgency around further investigations and referrals, long waits for scans and their results, and also missed symptoms and diagnosis. So services could also seem understaffed. When respondents talked about that, it was most often nurses that were cited there, and that was evident in long waits for alarms to be responded to, medication to be supplied, and staff not always available to answer questions. Daycare units were specifically highlighted in relation to staffing levels, and more generally, a lack of staff was particularly apparent at weekends and at night. Another sub-theme was respondents being frustrated by long waits in the hospital, and that could be for tests, treatment, beds, medication and operations, or it could be a combination of these. And these scenarios span daycare, hospital admission, discharge and at A&E. So in terms of long waits in hospitals, medication not being available from the pharmacy came out as a key point of delays. And as indicated by the quote we've got there, the bottom one on the slide, bed availability was often intertwined with issues around waits. And the final sort of element of this theme is about travel. So there was a desire expressed for services to be close to home, for efficient hospital transport and ease of parking, but experiences of these were mixed. There's also a suggestion in that it would be helpful for information about parking to be provided in advance. Okay, we then had a bit of a smaller theme around personalised care. And there were two very distinct aspects to this. So the first was around there being a need for psychological support and that being extended to wider family, as well as more accessible for patients, parents and carers as well. So here it's identified there could be absent or insufficient psychological support, and it came out that further consideration could also be given to better signposting to charities that could provide support. And there's also some information in there about services facilitating connections between parents or carers as a source of support for each other. And the other aspects that sub-theme under this theme were concerns highlighted to the risks for immune-compromised patients when they were in need of unexpected or urgent care, and there was a call for more consideration in this area. So this was one of the new sub-themes that came up this year. So it's very much about when people were going through A&E or they were placed in non-cancer wards, and it's felt that consideration was basically needed around the pathways that were being used there. Okay, so we had a big theme all around hospital food. So the headline there was food played a significant role in how children and young people experience their time in hospital. It was commonly raised as an area for improvement. Issues spanned quality and choice, how well the food met personal needs, as well as provision of food and adequate preparation facilities for parents and carers. So we had Zoe talk about quantitative question, that was all focused on food choice. And there 40% of parents, carers and children felt that there was definitely suitable choice of hospital food. And that was also one of the least favourably rated experiences. So the qualitative comments, they went beyond choice and they picked up on other aspects too. So children expressed a strong dislike of the food provided. They highlighted those limited options, which does obviously relate to choice, but they also picked up on a lack of nutritional value. And they heard that parents or carers could resort to supplying food because of the poor quality of what was provided. Then we had catering needs for different religions, cultures, as well as dietary requirements were not always considered or met. So things that came out there were personal needs around having halal food, food taking into account allergies, veganism, vegetarianism, and considerations also needed as to how treatment was impacting on children's appetite, their taste, their ability to eat, as well as where food was served. So you can see a quote around that at the bottom there, where food was basically being served where next to the bed and by the commode. There were a few positive exceptions where children describe food as good or nice, and a few examples where flexibility was shown to meet personal requests. So the comments about hospital food didn't just relate to children. We heard from the quantitative findings that 42% of parents or carers reported they were definitely able to prepare food in the hospital if they wanted to, and that was another of the least favourably rated experiences. So what came out in the qualitative was parents and carers made improvement suggestions around the food prep facilities, and what was drawn out there was requests for additional appliances, so microwaves, toaster, more cutlery. We also had better maintenance of kitchen equipment and improved cleanliness, as well as more fridge or freezer space. And then another aspect was where it wasn't already happening, parents or carers suggested hospitals should provide food for them, not just children. So the reasons for this were they felt unable to leave their child when they were too young or too ill, and it would also eliminate stress and expense. There's also a suggestion alongside this that shops and cafes in hospitals could be open longer hours and at weekends, and also stock a wider range of food. Okay, so another big theme we had was all around things to do in hospital. And the headline was play staff and activities were highly valued, though older age groups were less catered for, and there was unmet needs for access again at weekends. Improvement to Wi-Fi and the use of digital entertainment was also found. Hospital education was well received with requests for extended provision, again at weekends and bank holidays. So thinking back to the quantitative data, we saw although there'd been improvement over the last 4 years around being enough things to do in hospital, there was still room for improvement, and the qualitative again provided insight into where that could be achieved. So children made it clear how important it was to have play and activities incorporated into their care. They described how that provided fun and it helped them to relax. Within that, the positive role of charities was also acknowledged in terms of how they provided gifts, entertainment, and put on events. Now, where there was a need for improvements, people focused on activities not just being geared towards younger children, with more age-appropriate areas for tweens and teenagers. And they also talked about increased access to play, staff, and opportunities, including at the weekends and at bank holiday. Okay, so we had a sub-theme about Wi-Fi as well. So again, if we think back to the quantitative question, it was still, even though there'd been an improvement, there was still one of the least favourably rated experiences, and we saw there that only 42% of parents or carers felt that hospital Wi-Fi always met the needs of them and their child. And this was seen in the qualitative information as well, and it gave some insights into the impact of this. So we had the poor Wi-Fi, limited entertainment options, it restricted contact that people could have with friends and family, and it also impacted on parents' carers' ability to work. And then we had some findings around TVs and video gaming consoles not always being available or working. Okay, so mentioned education. So here had positive feedback on experiences of hospital, school and teachers, but again, where the focus was critical, that was on the need for provision to be increased. Okay, so we're now on to the last theme, which was about the hospital environment. So here the headline was noise and the ability to sleep in the hospital environment was experienced as an issue. There were calls for increased privacy, improved comfort of beds and chairs, and in some cases the cleanliness of the hospital environment was found to be problematic. So in terms of noise and sleep, the quant and the qual findings both gave weight to this being an area where improvements were needed. The quantitative question, again, was amongst the least favourably rated experiences, with only 26% of patients, carers and children reporting that it was always quiet enough for them to sleep in the hospital. In the qualitative comments, we could see that the reasons that it was too noisy were noise being caused by loud talking, beeping machines, TVs, and also staff making noise as they were carrying out their tasks. Another aspect of this the brightness of the environment could also exacerbate this inability to sleep. There were a range of improvements suggested suggestions of how a more restful environment could be created. So there we had having and enforcing rules around bedtimes, machines that didn't audibly beep, smaller wards or individual rooms, separating younger children from older children, provision of headphones, and staff themselves considering if and how they were disturbing sleep unnecessarily. So there's quite a few different elements for services to consider there. Okay. So there was also a preference shown for private rooms, and that was linked to having dignity upheld and having a quieter personal space to aid recovery. Children aged 12 to 15 saw it as important to be separate from younger children. The next sub-theme here was about the comfort of beds and the availability of bedding. That was raised as an issue for children and parents or carers. So again, going back to the quantitative data, we saw that was only 35% of parents and carers reported that facilities for them to stay overnight were very good. Again, one of the least favourably rated experiences, with the qualitative also picking up on comfort of beds. As well as the beds, there are also issues with comfort and availability of seating from children, including in daycare. You can see a quote, bottom quote on the slide backing that up. And then the final finding that I'm going to share is, it was a new one this year. It did appear occasionally last year, but it seemed a bit more prevalent this year. So it's about variable experiences around hospital cleanliness. Where that did come up, issues were often related to bathroom facilities, but also heard about unpleasant smells and dirty bedding. So, like I said, that's a really quick tour of the qualitative findings, a lot more detail in the report. So I'd urge you to go and have a look at that if you want to find out a bit more and see a lot more of the quotes, which really help bring the findings to life. Okay, so I think we've got a few minutes now if anyone has any questions.
Thank you so much, Estelle. So yes, if anyone has any questions for Estelle on that presentation, just before we move on to the broader discussion, please go ahead and raise them. Okay, no immediate questions. Thank you, Estelle. That was really powerful. Really informative insight there. Thank you. We have had one question in from Charlotte. So did you feedback specifically to areas which were mentioned?
Sorry, could you repeat that, Tamatha?
So I wonder if, Charlotte, would you be happy to talk us through your question a little bit more? Brilliant, thank you. Oh, we need to unmute Charlotte, if that's okay.
Hiya, can you hear me?
Yeah, perfect. Thanks, Charlotte.
Hiya. Yeah, I was just wondering, sort of, with all the wealth of knowledge you got, and lots of things that could have potentially been very specific to certain areas, were you able to feed any of that back specifically to certain organisations or groups, or wards specifically, or was, obviously, with it being anonymised, were you unable to do that?
So where we do share the free text information with services, we pull together all of that information into an Excel workbook, and that goes out to each of the PTCs and trusts, I believe. So you'll be able to look at the findings in the report and then dig in to anywhere that you want to look into. There's the data in there is categorised different categories, so you can filter it by category, you can filter it by age, etc. So that's kind of the way that we feed back that qualitative information. So the report is very much national, looking across the piece, but you can drill in into smaller areas through these workbooks.
Thank you. Thanks for your question, Charlotte. Any more questions before we move into the broader discussion segment? It's lovely to see questions about from people asking how they can get hold of the data and how they can do more with it. So we love those questions. Thank you. Okay, so over to you. Thoughts and reflections. So we've seen the results of the numerical results of the quantitative questions that we ask patients and parents and carers. And we've also had that really informative overview of what patients and parents and carers have told us in their own words as well. So going back to those 3 questions that that we posed at the beginning of the webinar, be interested to hear your thoughts on what you found most surprising from those results today. Do we have any takers for the first question? Are we able to unmute everyone? Sharon.
Just unmuted you, Richard, so should be able to.
Perfect. Can you hear me okay?
Yeah, can hear you. Thank you.
Okay, perfect. I think probably going to the questions, I think what surprises me most is probably a bit of the consistency of the results from previous years, I think is a really interesting one. And I think in many ways, I think that's a double-edged sword. I think, firstly, I think it's a testament to the research itself. I think that you're seeing consistency would suggest that it's probably on point on what the issues are. I think that's a testament to it. I also think it's a testament to where we're seeing high scores, we're seeing high quality, that's being maintained. But I think the challenge that then that presents is potentially where we are seeing those lower scores, where people are saying there's improvements needed. Actually, we need to look at step changes in the way that's potentially being done, because we're seeing such consistency despite attempts at improvement in some of those areas. So I think that's, the surprise bit, and a thought-provoking bit, I suppose, for us is how we make those step changes in the areas where we're consistently seeing lower scores or less good scores, I suppose, in that case. And I think on what insights resonate most, I think probably links to the themes about where I think where we'd most like to see improvement as well, I suppose, and the themes that children and young people and their families most commonly talk to us about. I think there are a number for us. I think there are probably 4 areas, I think, based on the work we're looking at. The first is around that need for improvement around the experience of diagnosis. I think it's probably one in terms of like giving the continued multiple visits that were talked about, and that sort of experience of receiving a diagnosis, getting the information they need around diagnosis, probably one. Second one is that travel element, so the need for support to travel. We know that 2 in 5 are regularly traveling over an hour. So how can we make sure that people are given the support they need to make that travel or receive support close to home? The next one's around the need for mental health support, I think is one that we've seen come in there. So only around about half, or just over half, I think, are saying they're being signposted to mental health professionals. So that suggests that around about half aren't receiving that support, and we know the impact that a cancer diagnosis can have on your mental emotional well-being. So what can we do to see improvements in that space? And then the final one's around post-treatment support. I think we've seen some good improvements there, but I think it's around a third saying there's still improvements in that post-treatment support. So I think that's an area for us, that how do we make improvements in that post-treatment support area? So I think those are reflections we had, I suppose, when we were going through the results from our side.
Excellent. Thank you, Richard. Some really excellent points there. Okay, so if I can move on to Amanda next, please.
Hi, thank you, and thanks for all the presentations. A couple of things. I think, like Richard, just would reflect that in the current climate, the results probably indicate the pace of change in terms of making improvements and how challenging that can be, particularly around some of those kind of facilities things, which are kind of beyond the immediate gift often of the sort of clinical team supporting patients. So it's just perhaps not surprising that you don't see the kind of marked improvement, even if staff are putting investment into that area. My questions were a bit higher level, really, and just a reflection on the drop in the response rate, and just how we do get kind of valuable feedback again from patients when I think people just feel a bit saturated, not necessarily by surveys, but by life, I suppose, and just everything that brings, and just whether you know from the results how representative the responses are for the overall kind of patient demographic that we see coming through our services. So whether it feels like we get a kind of a sample of feedback that is reflective of the total paediatric population, if that makes sense. I know that's a bit of a broad question, but I think it's helpful to then know whether we're hearing from the kind of patients and families who are quite open to giving feedback otherwise and who typically do, and whether we're still perhaps missing feedback from some of the families who are perhaps slightly less inclined to engage in that process.
Yeah, some excellent reflections and questions in there, Amanda. In terms of the response rate, I'll hand over to my colleague Zoe, who leads our quantitative analysis. But just as a broader reflection, you're right about survey fatigue. I won't comment on the broader life fatigue, but survey fatigue, absolutely, not just across patient surveys, indeed all surveys. And we all know the experience of being asked for more and more feedback as part of our daily lives. So it's something that we continue to think about ways of tackling. It's particularly pertinent for this survey as well, given that value that we have in getting feedback from children and young people directly, but the challenges of making sure that our survey gets feedback both from the child and also from the parent and carer as well. It's these surveys of children are probably more complex than any others. So the other thing that I would say is that we're really keen to hear from you, in your experience, what else we can support, or ideas that you have for how we can raise the profile, support that message about the importance of using this opportunity to feedback on care. I think the results that we've seen this morning show that there's a lot of power there, particularly in some of the qualitative feedback as well. So anything that we can do to support you locally in order to increase messaging, we'd be really keen to hear about it. Zoe, if I can hand over to you to talk about representativeness, please. Thank you.
Yes, no, thank you. And yeah, completely agree with what Tamatha said to do with the response rates themselves, and encouraging people to fill out the survey. I guess in terms of representativeness, what I can say is that we did look at a couple of years back now, I want to say maybe 22, maybe 23, we did look internally at response rates and seeing whether it was representative or not. And so we might want to revisit that if time allows. But what we did see is that, relatively speaking, it is a representative sample across different subgroup demographics. There's not many that we can look into just because of the sample data that we have, but there was one difference that was kind of a bit more noticeable, and that was that the deprivation level, the IMD quintile breakdown, there tended to be in the sample more people from the most deprived areas, but people from the least deprived areas were overrepresented slightly compared to maybe other subgroup breakdowns. On the whole, I would say it was quite representative, but I think that was maybe something that we did notice across the subgroups. But like I said, there's because of the sample data that we have, there's only, I think, 4 or 5 different breakdowns that we are able to compare for under 16s.
Thank you. And also just the response rate thing, it's not a criticism, it's just a statement of
absolutely.
I just think it is a really difficult thing to cut through, and we see that in terms of the things we invite patients and families to to participate in region. It's really challenging, I think, to kind of grab people. So I don't really think it's negative.
No, it's always important to talk about. There's barely a week that goes by that we wouldn't be reflecting on it. So it's not taken as a criticism at all. And thank you for observing. Again, any feedback you want to share with us, perhaps if you don't want to do that here on the call, we'd be really happy to receive it after the call as well, any ideas that you might have and support we can offer. Okay, if I can move on to Rachel now, please.
Thank you, and thank you for the presentations. It was really illuminating. I'm not necessarily going to answer your questions, but just some observations really. But perhaps the first one, I think within, everyone in every PTC strives really hard to deliver the best care they can, but some of those responses are really quite low. I think in terms of, I can't even pick them out. Was it around information giving in an appropriate way was only around 70%, or perhaps there were some that were surprisingly low to me, given that there's an expert level of care across all PTCs. And in terms of learning from this, I would really like to see questions allied to that from the parents and carers and children, as this is your impression, but what can we do to make this better? Give us some concrete suggestions, because we can do things that we think people want, but that might not be right. That might not be the right perspective. But also looking at learning across every PTC, because you've got a sort of nationalised combination of the outcome data here, which I think, knowing the range across every PTC and the outliers and those who are really good, and what can we learn from a particular PTC that scores very highly on one point that can be spread across all the others. So I think having a sort of an average is helpful, but also having a look at each centre and what they do well or not so well, and trying to learn from each other is really important.
Absolutely. I think we can take that away as an action to reflect upon. Of course, results are available at PTC level. So I think we've shared a link to that in the chat, and that they're certainly on the website and would have been shared back directly with PTCs. But yeah, I think there's a reflection for us in terms of how we can support that communication aspect in terms of sharing best practice. I think this survey and certainly our cancer patient experience survey are already doing some pretty brilliant things in that area through cancer improvement collaboratives and so on and so forth. I guess could I risk throwing that out to the group here, and do you have any reflections for how you might be tackling that particular area in your trusts? Anything that we can use as a spur for sort of information sharing here and now? You going to come in, Amanda? No.
Sorry, I didn't realise I'd left myself on mute, but no, I wasn't. I'm just thinking about it. But
Okay. Okay, leave that one with us, and we'll come back with some feedback to the group. Okay, so any other questions? What has surprised you most about those results? What has resonated with you the most? Or what are the things that are sticking with you that are making you think about where you might want to reflect on improvements locally, or share some of your feedback on what's working well? Helen.
Hi, thank you for your presentations. I think I've got similar reflections to what's already been mentioned, really, that a lot of it is sort of like the basic facilities and the way that the hospitals are structured that families are still struggling with. And there's a lot of work going on in those areas. I'm thinking, it's still low that parents are still saying it. They've only got, I think it was 42% ability to make food or have food. And there's work like Sophie's Legacy, which is going on a national basis. So some of these issues are being picked up, which is good. And I guess back to Richard's point of it, they tend to be the consistent things, which makes it easier to do from a sort of national level to pick up some of these issues. But it's obviously they're still not having a real impact at that level. You know, you'd think they were quite basic things, some of them, but they're really difficult to challenge, like, you know, why we still can't let people have any sleep, why the beds aren't very comfortable, you know. And then there's also things about, I think a lot of I was still quite surprised by these, I think it was only 66% said that they really knew what was happening with their child, considering I know how much effort everybody goes into communication. And I wonder whether that's sort of indicative really of the, you know, that wasn't just with the child, but that was also picked out communication challenges internally and between hospital sites. And I do wonder whether it's almost a reflection of the way that we work. You know, people do shifts, medics are doing attending. There's the continuity is not there that perhaps it was back when I started a millennia ago, where you did sort of 7 days on and 7 days off. You got the continuity then, but also the issues around the staffing levels, all of that. I think it all feeds into the same issues that are then being felt from the parents. So, you know, on the flip side, it's really good that despite all of those challenges, the parents are still thinking staff are really friendly and really helpful. So I think on an individual level, for me, these surveys always show how hard each individual is working. It's the structures that we're kind of held within, and I'm not going to get into not even going to mention budgets today, but you know, all that whole aspect really. So I think the thing again that it always comes across is the absolute centrality of those sort of staff relationships with parents, and that can go a long way to mitigating some of the structural issues that perhaps we're struggling with, and that makes such a difference. And then I think from a prioritize, I mean, there's some national work going on within the ODNs about strengthening communication between hospitals. So it'll be interesting to see if that gets any traction. And then the use of other organisations like CCLG around, you know, they've done a huge amount of work on training, particularly thinking about the sort of non-oncology based. It's how do we get, so there's a lot of work out there, it's how do we get it down to the right places, I think. So there's a lot of training for oncology staff, but how do we share that properly with places? And an interesting comment someone made about the need for sharing, I think it was Rachel, the highs and lows, if you like. And I wonder whether that's something that across the sort of 7 ODNs, that's something that we could look at as a sort of national piece of work to see where we could share best practice and that sort of thing, really. So yeah, those are probably my reflections. And other things, you know, like play, the national play standards are about to come out. So how do we use those to try and drive up some of the comments that people are making around play?
Fantastic. Thank you, Helen. Do we have any other reflections? Additional questions on what we've presented today? Or equally, is there anything that you would like to tell us and the group about improvements that you've been able to make in under 16 cancer services that you'd perhaps like to, that you think are having an impact on your results locally? Perhaps not today. Okay, so I think we've exhausted questions now during the reflection slot. Thank you so much to colleagues that have shared with the group. So next we're going to hand over to Jodie from the Cancer Programme team, just to share some sort of closing reflections. Thank you.
Thanks very much, Tamatha. And I did see Amanda's hand go up just at the end there. So if you have got any examples that you'd like to share.
I was only just going to quickly say, I mean, there's loads of work happening, and Helen and other colleagues would be far better placed to talk to it. But we've looked at things like pre-recorded kind of play activities that families can access at the weekends, or joining kind of, if you like, a virtual session. So it might be led by a play therapist in a single room in the hospital, but other patients around the hospital can kind of join in. Lots of our regional teams are looking at how they improve their facilities and working with charitable partners to try and get some improvements in their ward facilities. So, I mean, they're nothing revolutionary, but it was just to say we are, you know, if you were looking for things, I think there are ways, and maybe again having some kind of whether we can have, I don't know, like on a futures site or something, a sort of central repository of some of the suggestions and things that people, you know, the really tangible things, because I think it is, as Rachel indicated earlier, it's sort of trying to pick out what you can actually do in practice around some of those things. Some of them take longer to kind of resolve, like Wi-Fi and things, but some of them there might be some creative solutions coming out. So sorry, it was just to give some, you know, I didn't want you to think that I'm sure that is like literally the tip of the iceberg. There'll be a million projects happening across the country, but just obviously people are, you know, taking heed to what's being said. There was one other thing I was just going to comment in, and actually just thinking about how positive it is that you have got reasonably consistent scores, because I imagine if we were to kind of slightly flip the perspective and look at the staff experience at the moment in terms of working in services, I imagine it feels more pressurised than ever. I know capacity is a real issue in our region in the southwest, and just the kind of the psychosocial kind of complexity of patients and their families coming through, partly because of, you know, the kind of current landscape. So I think it's not something to kind of take lightly that the scores feel consistent, and actually that is in itself really positive. And a lot of our work, we're kind of just talking about how do we maintain what we're doing, and it doesn't kind of get too pulled astray by all the other pressures that are going on. So yeah, that was one final. I'll shut up now, sorry about that, but thanks.
Not at all, that's really helpful and welcome. Thank you, Amanda. And we have Anna, I think, on the call, who leads for experience of care within the cancer programme and works really closely with experience engagement leads up and down the country, and will be thinking about what more we could be doing to capture and share examples that have been happening around experience. And I think what is really nice, I mean, these webinars always, it's lovely to also complement them with some examples and a presentation from a service who is making a difference and really prioritising this area. So we really always welcome people volunteering to get involved in these webinars and sessions. But just to take a bit of a step back then, so I'm Jodie. I'm one of the deputy directors in the cancer programme. And the cancer programme, for anyone who's not familiar, we really have three key priorities. We work on driving up operational performance, improving early diagnosis of cancer because it's so important for survival, and improving care and experience for those who've been diagnosed. And we work really closely with regions and with cancer alliances on those objectives. There is a lot of work that happens on cancer that sits outside of our team, and we work really closely with loads of other people, including genomics and screening teams, etc., to help drive improvements in cancer care and outcomes. And we're really pleased to work closely with Insight and Voice colleagues on under-16 CPES. So if we can just go to the next slide. I could probably do these myself, Sharon, do I? Yeah. But we've heard some of this, haven't we? Some of these names and areas of work that have been highlighted in the conversation so far. I think from our perspective, under-16 CPES as a national picture is hugely helpful, and there is much to celebrate. And as Helen was speaking to, the overall levels being what they are really do speak to the individual health professional kind of level of care and input, and how much they are investing into the patients and into the parents and carers, and trying to drive as much improvement and great and excellent care for patients as possible. But there are also some areas of improvement, and we saw those 4 areas where we were seeing data under 50%, and they are, as has been noted, a lot around the kind of structural challenges and wider issues, and not necessarily in the control of clinical teams. But I just wanted to pick up these stories, Sophie and Henry. And for those of you who aren't working in these areas already, or just think it might be helpful just to give things an extra little push, I just wanted to make sure we weren't forgetting these digital stories and powerful resources that these children and their families have created, so that we can help bring the importance of investment in these areas and improvement in these areas to life and drive them forward. I think I was also touched by or noticed what Rachel had said. I think it was around some of the results around having enough information, having your diagnosis communicated in a way you understand, and the sensitivity. And that also really strikes me in the adult survey. It's not under 50, it's not over 90, but I don't think 70-75% is where any of us really would want that to be. And so really keen that we can continue to look at ways to improve that. So just if we can go to the next slide, and Tamatha mentions our Cancer Experience of Care Improvement Collaboratives. And this is one of the ways in which we as a national team are able to draw on the data from under 16 CPERS and also from national CPERS to inform the priorities and kind of focus areas for projects who take part in the collaborative. And for those of you who aren't aware, it is a coaching and quality improvement framework. And at the moment, we have about 16 projects taking part in our KIC 7 cohort. And since about 22-23, we've really encouraged projects that work to all ages. So this year we are really pleased to have a couple of specific children and young people projects, and we've had that in recent years as well, which is really positive. And as a previous commenter noted, it's what's at the heart of this is also the co-production and working really closely with people who've got lived experience. So we're understanding what's important, we're drawing on their input and expertise to help shape those solutions, guided by the data as well, and really coming up with things which are going to have a lasting impact. And that we found through our evaluations, internal evaluations of the collaborative, that it creates a legacy for patients and for staff who really value the time that they're able to spend and in the changes that they can embed with these collaboratives. So more information on the web link there. And thank you to everyone who is up and down the country working in the current cohort, but also the previous cohorts. And we had a reflection event recently where our KIC 6 projects had come together to share an update. And although the projects drew to a close in May, from our perspective, many of them have really continued, and we are seeing some of the impacts being felt in some of the ongoing CPERS data, which is really great. And hopefully we can get to that point with under 16 CPERS data too. And then I think the last thing I was just going to very briefly mention is the kind of interaction with other areas of care that's so important. So personalised care, living with and beyond. Richard touched on things around how important it is that we make a smoother diagnosis for children and young people as possible, and we avoid the delays and the repeat consultations that many patients go through. And we are working really closely with colleagues in the department and the ministerial team on the cancer plan, which you will be aware is due out early next year. And at the same time as the Secretary of State announced the call for evidence for the cancer plan, back in February time, he also announced the Children and Young People's Task Force. And that task force has really been working hard to develop a specific chapter within the cancer plan and to formulate some recommendations that will help shape and improve care and experience and outcomes for children and young people. So we're very much looking forward to seeing those published in the cancer plan next year, and of course all of the work that happens thereafter to actually ensure that the plan becomes reality and drives those improvements for patients and their families and carers that we all want to see. So I think I will just draw to a close there and just say a huge thank you to you all for all you're doing to drive care and improvements in experience. And if anyone has any questions or comments, are welcome to take them, or we can pick up offline. And thanks again.
Thank you so much, Jodie. Okay, so for the last time today, your opportunity to ask us any questions, either on anything that Jodie has just been reflecting on or in the webinar more broadly. Am I missing any hands? I obviously did a fairly miserable job previously and missed, I think it was Amanda, just as I was coming off the call. Okay, no, I don't think I'm missing anything. Okay, well, on that note, just to echo Jodie's thanks to you all today. I know it's a big undertaking, sparing an hour and a half from your day, so thank you for sharing that with us, taking the time to listen to the national results of the Under 16 Cancer Patient Experience Survey. As you would expect, we love feedback, and so we'd be very grateful if you could share any feedback with us about your experience of the webinar today. That will enable us to make improvements so that we do even better next time. Anna has also, Anna Rarity from the Cancer Experience Programme has also shared her email in the link as well if you want to reach out after the call and make contact with Anna. So on that note, I'm going to wrap up, give you 8 minutes back of your day, but thank you very much for your time again, and please do get in touch if you want to discuss anything further. Thank you.